Every year, over 300,000 babies are born with sickle cell disease across the globe. That's one baby every 2 minutes. According to the World Health Organization, most of these children are born in sub-Saharan Africa, where access to early diagnosis and treatment is extremely limited. In the United States alone, it's estimated that about 100,000 people live with sickle cell disease, and despite medical advances, many still face painful crises, hospital stays, and shortened lifespans. Sickle cell anemia isn't just another chronic illness. It's a genetically inherited blood disorder that turns a person's own blood cells against them. If left undiagnosed or poorly managed, it can quietly damage major organs, disrupt oxygen flow, and even lead to life-threatening complications. In today's video, we're breaking down what sickle cell anemia really is, how it develops, what symptoms to look out for, and why early detection could make the difference between life and death. And don't worry, we're also covering treatments that are helping people live longer, fuller lives. But first, let's understand the problem. Sickle cell anemia starts deep within your DNA. It's caused by a mutation in a gene called HBB, which is responsible for producing part of the hemoglobin protein. Hemoglobin carries oxygen through your body, but when someone inherits two copies of the mutated gene, one from each parent, the body starts making abnormal hemoglobin called hemoglobin S. This faulty protein causes red blood cells to lose their normal disc shape and instead form sharp, crescent-like structures that resemble a sickle. These sickle-shaped cells are stiff and sticky. Unlike healthy red blood cells that live around 120 days, sickled cells die in just 10 to 20 days. This rapid breakdown leads to chronic anemia, which means the body isn't getting the oxygen it desperately needs. But the damage doesn't stop there. Sickled red blood cells also have a tendency to clump together and block blood vessels. This triggers what's known as a vaso-occlusive crisis, where the oxygen supply to tissues gets cut off, resulting in excruciating pain. These pain episodes can occur suddenly and can affect the chest, back, joints, abdomen, or even bones. They often come without warning and can last for hours or even days. Over time, these episodes damage tissues and organs, including the liver, kidneys, lungs, and brain. And for some individuals, especially children, one of the earliest signs may be swelling in the hands and feet, also known as dactylitis. This happens because the tiny blood vessels in these areas become clogged with sickled cells. Let's talk about the signs and symptoms, because recognizing them early is crucial for getting the right treatment. One of the most common symptoms is severe fatigue. People with sickle cell anemia often feel constantly tired, weak, or lightheaded. That's because their red blood cell count is too low to carry enough oxygen to their tissues. This condition is what we refer to as hemolytic anemia. In children, this fatigue may show up as trouble concentrating, poor academic performance, or slowed growth. Another red flag is jaundice, which causes the skin or whites of the eyes to turn yellow. This happens because the liver is overwhelmed by the breakdown of sickled cells. Some people may also notice dark-colored urine, which is another sign of excessive red blood cell destruction. One of the most dangerous complications is acute chest syndrome. It mimics pneumonia but is far more serious. It often comes with chest pain, shortness of breath, and fever. This condition occurs when sickled cells block oxygen flow in the lungs, making it one of the leading causes of death among individuals with sickle cell anemia. Another life-threatening complication is stroke. According to the American Stroke Association, children with sickle cell disease are up to 300 times more likely to suffer a stroke than their peers. That's why sudden symptoms like weakness on one side of the body, slurred speech, or facial drooping should never be ignored. Even more concerning, many children with sickle cell disease experience what's called a silent stroke, which may not show obvious signs but can still cause learning problems and memory issues. The immune system also takes a heavy hit. Normally, the spleen filters bacteria from the blood, but in sickle cell patients, the spleen often becomes damaged early in life. This leaves them more vulnerable to severe infections like pneumonia, meningitis, and sepsis. For infants and young children, even a simple fever can be a medical emergency. That's why early childhood vaccinations and prompt treatment with antibiotics are essential for survival. In fact, a child with sickle cell disease who develops a high fever should see a doctor immediately. Every hour counts. Now, let's dig into the causes of sickle cell anemia. It's an inherited condition, passed down when both parents carry the sickle cell trait. People with only one copy of the gene are said to have sickle cell trait, and usually don't show symptoms, but they can still pass the gene to their children. If both parents carry the trait, there's a 25% chance with each pregnancy that the child will have full-blown sickle cell disease. That's why genetic counseling is so important, especially for couples who may both be carriers. Many regions now offer newborn screening programs to detect sickle cell disease at birth, allowing for early intervention. The disease is more common in people of African, Mediterranean, Middle Eastern, and Indian ancestry. In the United States, about 1 in 365 African American babies is born with sickle cell disease. But due to global migration and increasing awareness, it's being identified in broader populations. Understanding your genetic background and whether you or your partner carry the sickle cell gene can help you make informed decisions about your future family. Without proper care, sickle cell anemia can lead to a range of long-term complications. These include vision loss from retinal damage, leg ulcers from poor circulation, delayed puberty, organ failure, and chronic joint pain. Some individuals also develop gallstones due to the constant breakdown of red blood cells. And while medical advances have extended life expectancy, sickle cell still significantly shortens lifespan if not properly managed. In low-income countries, the majority of children with the disease don't survive past age 5. But here's the turning point. Sickle cell anemia is no longer a hopeless diagnosis. Thanks to scientific breakthroughs, early diagnosis, and better treatment options, people with sickle cell disease are now living into their 40s, 50s, and beyond. And that's exactly what we'll cover in part 2 of this video, because it's time we talk about solutions, from hydroxyurea to curative gene therapies, and how daily choices can help you or your loved ones manage this condition with strength and confidence. If you've made it this far, stay with us, because the second part could change everything you thought you knew about sickle cell treatment. Let's begin with something that's easy to overlook but incredibly important: daily management. Many people with sickle cell anemia live with the disease for decades by following a simple yet powerful strategy: hydration, nutrition, infection prevention, and regular medical care. Staying hydrated helps keep the blood thin and flowing more easily, reducing the risk of painful blockages. Dehydration can trigger a crisis in just a few hours, especially during hot weather or after physical exertion. That's why doctors often recommend that both children and adults with sickle cell drink plenty of water, at least 8 to 10 glasses a day. Nutrition also plays a huge role. People with sickle cell anemia have higher nutritional needs because their bodies are constantly working overtime to produce new red blood cells. A diet rich in folic acid, vitamin B12, and iron-free multivitamins supports the production of healthy blood. Leafy greens, legumes, and whole grains are great options. However, many patients are advised not to take iron supplements unless prescribed, since excess iron from repeated blood transfusions can build up and harm the liver and heart. Speaking of infections, this is one area where sickle cell patients face higher risk due to impaired spleen function. The spleen, which helps filter bacteria and fight infections, often becomes damaged in the early years of life due to repeated blockages. Without it, even a minor infection can escalate quickly. That's why children with sickle cell disease must receive all routine childhood vaccines, plus additional ones like the pneumococcal and meningococcal vaccines. Many are also given a daily antibiotic, such as penicillin, from infancy until at least 5 years of age to prevent deadly bacterial infections. If you or your child has sickle cell disease, remember, a fever is never just a fever. Any temperature over 101 degrees Fahrenheit, 38.3 degrees Celsius, requires immediate medical attention. Now, let's talk about medications. One of the most widely used drugs for sickle cell anemia is hydroxyurea. This medication helps the body produce fetal hemoglobin, a special type of hemoglobin found in newborns that doesn't sickle. By increasing fetal hemoglobin, hydroxyurea reduces the number of painful crises, lowers the need for blood transfusions, and even decreases the risk of stroke. It's been a game changer for thousands of patients. In fact, some studies show that children who start hydroxyurea early in life have better growth, fewer hospitalizations, and longer lifespans. And contrary to earlier concerns, the long-term safety of hydroxyurea has been well established. It's now considered standard care for most people with sickle cell disease. Another medication is L-glutamine, an amino acid supplement approved to reduce the number of pain episodes. It works by reducing oxidative stress in red blood cells, making them less likely to sickle. Patients mix it into a drink twice daily, and while it doesn't work for everyone, many experience fewer hospital visits and better energy levels. Then there are more advanced drugs like crizanlizumab, a monoclonal antibody that prevents sickled cells from sticking to blood vessel walls, and voxelotor, which improves the ability of hemoglobin to carry oxygen. These treatments are usually prescribed when hydroxyurea alone isn't enough, and they represent a new era of targeted biology-based therapy. But what if you're looking for something more than symptom control? What if you want a potential cure? That's where things get really exciting. The first curative option is a bone marrow transplant, also called a hematopoietic stem cell transplant. This procedure replaces the patient's faulty stem cells with healthy ones from a matched donor, often a sibling. If successful, the patient can produce normal red blood cells for life. But there's a catch. The procedure carries risks, including rejection of the donor cells, infections, and the need for lifelong immune suppression. Plus, finding a perfectly matched donor isn't always possible, especially for patients from underrepresented ethnic backgrounds. Still, for many families, this transplant is worth it. Success rates are highest in children under 16 who haven't developed severe organ damage, and with the right preparation, it can offer a full permanent cure. But the real breakthrough came just recently: gene therapy. In 2023 and 2024, the FDA approved the first CRISPR-based gene editing therapy for sickle cell disease called Casgevy. In this procedure, doctors collect the patient's own bone marrow stem cells, edit them in a lab to turn on the production of fetal hemoglobin, and then reinfuse them back into the patient after intensive chemotherapy. Early results have been nothing short of remarkable. Over 90% of patients who received Casgevy reported zero pain crises in the following year. Another gene therapy, Lyfgenia, works by inserting a healthy beta-globin gene using a viral vector. Like Casgevy, it's showing strong success in clinical trials. These cutting-edge therapies are currently only available at select medical centers, and they come with a hefty price tag, over $1 million per treatment. But many insurance companies and global health agencies are beginning to cover the cost, especially given the long-term savings from fewer hospital visits, transfusions, and complications. So what does all this mean for someone living with sickle cell disease, or for a parent raising a child with it? It means there's hope. Real, science-backed, life-changing hope. It means that pain no longer has to define your daily life, that you can go to school, build a career, raise a family, and plan for a future that once seemed impossible. But it also means being proactive, staying informed, sticking to your treatment plan, and talking openly with your medical team about new options. If you're newly diagnosed or supporting someone who is, here are 5 key steps to take right now. 1. Find a hematologist with experience in sickle cell care. 2. Stay up to date on all vaccinations and ask about antibiotic use. 3. Drink plenty of fluids and eat a nutrient-rich diet. 4. Ask if hydroxyurea or other medications might be right for you. And 5. Discuss whether you or your child might be eligible for gene therapy or a transplant. It's also a good idea to keep a pain journal, tracking what triggers crises, how long they last, and what helps manage the pain. This can be incredibly useful for doctors when adjusting your treatment plan. The journey with sickle cell anemia is not easy, but it is navigable. With education, strong support, and modern medicine, people are living longer, stronger, and with more possibilities than ever before. And remember, every time we talk about sickle cell, share information, or support someone living with it, we help break the stigma and bring hope to thousands more. If you found this video helpful, please give it a thumbs up. Share it with someone who needs to hear it, and subscribe to our channel for more clear, science-backed health insights made simple. Your voice could save a life.